Hi, friends. Let's talk about iron deficiency anemia and sideroblastic anemia. You cannot talk about iron deficiency without saying few words about sideroblastic anemia. And I also spend a little bit more time talking about treatment plan. It's right here in front of you. Why? Because my client wrote to me and said, I assume that if there is a deficiency, means that everything's supposed to be down. But no, look at that. Something is normal, something is high, low, low. And white blood cells and red blood cells are normal. Why? Could you explain? Yes, I will. So, sideroblastic anemia is deficiency of vitamin B12. Vitamin B12 is the building block for the blood cells. And usually they are nice and round and big. When you do not have building blocks, the cells become smaller. And the size of the cells, small size of the cells. This is the one and only common feature with iron deficiency anemia, between sideroblastic and iron deficiency anemia. Small size of red blood cells. Iron studies in sideroblastic anemia will be absolutely normal or even high. Now, treatment plan. What you are going to do? If on the laboratory work there are results for vitamin B12 and it's normal or high, then you don't need to take it. If the status of B12 is unknown, then the treatment plan is going to be easy iron. Why easy iron? Because iron by itself causes severe constipation, and it's better to take easy iron, easy on the digestive tract. Vitamin C to increase absorption of the iron, and vitamin B12. Now, warning, do not assume that your anemia is due to your eating habits, because you don't eat, let's suppose, red meat. So people are vegetarians. Do not assume, because even vegetarians may have other causes of anemia, including cancer. And our job is exclude this cause, because, you know, it's could be patient could die. Now, back to laboratory work. These terms you must memorize, right? Let's go. Iron, serum iron in the blood. Transferrin is a protein that will carry iron to ferritin, and the ferritin is the storage. So iron goes from bloodstream to the storage. Total iron binding capacity reflects the available iron binding sites on transferrin. Percent of saturation is how much of this transferrin, the transport protein, is saturated. How many seats are occupied and how many seats are empty. It's important. MCV stands for mean corpuscular volume. Corpuscular means red blood cells. When the microscope was invented, scientists took a drop of bloodstream, they looked at the microscope, and they saw red blood cells, and they said, oh, corpuscular. And since that, we are still using this term. This is my contact information. That's it, guys, who are watching my videos for 2 minutes only. So you have a treatment plan, go ahead and do that. The rest of the video is for people who want to understand what's going on with this iron, how it's moved between bloodstream into the storage, and what happened to this iron during the anemia. Okay, and for that, we are going to talk. We are going to go with you to the blackboard. Let's go. So you are looking at my favorite picture of the digestive tract. Here is the mouth with the teeth, esophagus, stomach, small intestine right here, large intestine right here, and we go to the bathroom. Here, the red structure is blood vessel, and this blue is a bone. Now, a couple of words about B12. When B12 is low as a building block, the body cannot make a nice and round red blood cells. As a result, under the microscope, red blood cells do not look like that, the nice and big. They look like that, small. And also, iron that it's there. So usually there is 4, oops, let's throw green iron. Iron is right here in the red blood cells. There is 4 irons here, and there is only 1 here. Okay, so it means that the red blood cells cannot work properly. So B12 is really important. Now, what you're looking here on the picture, this green dots are actually iron. This red is the red blood cells. So usually they are normal size, they look like that. The yellow circles are transferrin, the protein that carries iron into the storage. So, and here is the storage, iron in the storage. It's called ferritin. Ferritin. Let's write it here. Ferritin. Ferritin. Okay, it's a storage. Iron actually in real life, there's not much of that just floating in the bloodstream. Most of the iron is distributed between red blood cells, and the rest, or a lot of that, also sits on this transporting protein on transferrin, and it goes into red blood cells and transferrin is actually carrying that iron into the storage to ferritin, and sometimes it goes back. So this is the normal situation. Now, let's suppose person had blood in the stool, all right? So blood is lost, means that haemorrhoids. What lost? Red blood cells go out, iron goes out, transferrin goes out, so everything is down. Person runs into gastroenterologist ties the hemorrhoids, bleeding stopped. 2 days or 3 days later, person is still tied, goes to the primary care physician and does laboratory work. What you're going to see, and laboratory work is iron deficiency anemia. What you're going to see, okay, iron is still low, okay? However, there are a couple compensating mechanisms already working. Number one, red blood cells that are produced become smaller, and they can sit only little iron. So small red blood cells. So let's write it here. Red blood cells, small. Iron is depleted because it's lost. Now, the second compensating mechanism is body starts to produce more of that transferrin, the protein. Why? So here is your body has more transferrin because it wants that transferrin to go here into the storage, pick up this iron. Let's draw the iron green. It wants to pick up that iron here from the storage and transport it here into the bloodstream because it needs iron to put it here into red blood cells, because red blood cells are really important. They are carrying oxygen, and iron is a helper to do so. If you do not have enough iron in your tissues, you're in a big trouble. Okay, so it started to carry iron out of storage, out of ferritin. Concentration of the iron of ferritin becomes low. So now what we have, small red blood cells, high transferrin, low iron, and low ferritin. And obviously, because body is producing a lot, let's draw them again yellow, producing a lot transferrin, okay? And some of the iron is sitting here, but percent of saturation is low, okay? So saturation of this transferrin is still low. Now, couple important things. This patient get advice from the primary care physician. Oh, you should take iron supplements and you should eat iron-containing food. So patient goes home. Let's draw the iron here as a green. Patient goes home and start to eat iron. Take the supplement or eat red meat, eat liver. Iron goes here in the digestive tract. Iron get absorbed here. So we start to build iron in the bloodstream. This iron becomes available and it goes immediately into red blood cells. Now, as more and more iron get available here in the bloodstream, then it sits here on transferrin, and the transferrin start to transfer this iron back into the storage. The storage needs to be replenished. Now, the process of absorbing iron and putting iron here in the bloodstream takes several days before you can actually see that iron started to build up here. So let me write here, the process is long, days, okay? It takes even longer for iron to be replenished from the bloodstream into the ferritin. It takes weeks, okay? So the process does not happen like that. It takes time. As a result, when you will be looking now at the PowerPoint presentation, at the clinical case that I showed in the beginning, you will see why some things are up and the other are down. So let's go to PowerPoint. I stole the slide from a medical textbook. So iron deficiency anemia. It's a summary for you. MCV, low, small red blood cells, because it's a compensation mechanism. Iron is still low, storage is still low. However, body makes a lot of transferrin protein. Try to shovel that iron from the ferritin from the storage, and obviously total iron binding capacity will be high, but saturation is low because there is a lot of transferrin. And here is your sideroblastic anemia. MCV, main corpuscular volume, is low, but the iron either normal or high even. So you can see even in the storage, ferritin is the high. So only the same is MCV in both anemias. Now let's go to this clinical case. So female does not have gastrointestinal bleeding, and carcinoembryonic antigen 19 is negative in this particular case. And person started to take iron and B12, and then she did the laboratory work. So she already started to replenish iron. So her total iron is normal, okay? However, the body is still produced a lot of binding protein, the transferrin. So you can see iron binding capacities are high. Saturation is low, and ferritin storage is still low. However, you can see red and white blood cells are normal, means that there is no B12 anemia. Okay, so I want to bring your attention to CA19 is negative. Why it's important? Because causes of anemia. In males, the most common cause of anemia is ulcer, haemorrhoids, IBD, and then cancer. That's why the patient was tested. Then, when those are excluded, including cancer, because you don't want to miss a cancer in a patient, then you can think, okay, maybe because patient is taking non-steroid anti-inflammatory, maybe patient is taking proton pump inhibitors such as omeprazole, right? We know that it will definitely decrease absorption of the iron. And then you think, oh, maybe the patient is vegetarian, does not eat enough iron. In females, the most common cause of anemia is heavy periods, okay? And then the same as in males, ulcer, hemorrhoids, IBD, and cancer. And then you can think about non-steroid anti-inflammatory, PPIs, and vegetarian. However, if the female menopausal and there is no periods, the causes of anemia becomes the same as in male, ulcer, hemorrhoids, IBD, cancer, and only then you're thinking, oh, maybe she's taking non-steroid anti-inflammatory, PPIs, and or she is a vegetarian. Okay, guys, that's it. I hope you understand everything. If you have any questions, just ask me. Thank you very much. Like, subscribe. Bye-bye for now.